Hey you guys, welcome back to the Mountain Morning Show. Now it's time for a quick sneak peek of the younger you. And a couple years back, of course, when First Lady Michelle Obama arrived on the scene, there was lots of buzz about those amazing arms that she has. And I know you guys know what I'm talking about. They're just her upper arms, kind of phenomenal. All right, well, Troy Thompson with ABC4 for this episode of The Younger You talks a little bit about how we can get that going. I know that's what Joe's interested in, as am I myself. Here it is, The Younger You.
Thanks, team. Well, tonight is all about what we call in Australia tuck shop arms. Now, that's where the loose skin is hanging down on a woman or a male's arm. Take a look at tonight's clip. Brachioplasty, or as we call it, the Michelle Obama effect. Now, what is it?
Essentially, we're removing excess skin from the upper arm to give the arms a better contour and look.
Okay, not possible from just working out at the gym?
On the patients who choose to do this, no.
Okay.
If there's any other option, we do it because we don't like scars. We're cosmetic surgeons.
Yeah.
So we only do this if we have to.
Remember when Michelle Obama first came into the White House, there was a lot of chatter about her arms and how amazingly toned they look. Can you get that look with this type of cosmetic surgery?
You could get a really nice look. The only downside is on the inside of the arm, there'll be a mark. This patient has what I would consider a fairly severe case of upper arm skin excess. For mild cases, we actually don't do the full incision down the inside of the arm. We can actually do an incision that runs to the front and the back of the armpit and take out a little ellipse of skin that way and pull it in this way. That combined with some liposuction can really improve the contour of the arm.
Because it's my turn. You know, I really think my daughter that's fought with her health is doing well, and it's my turn to take care of me, at least for a little while.
Dr. Dunkley, thank you for joining us today.
You're welcome.
All right, brachioplasty. Did I pronounce that correctly?
Pretty close.
Okay,
brachioplasty.
Good. What is it? So everyone at home can understand.
It's the removal of extra skin and fat on the upper arm, usually from the elbow to the shoulder area, and sometimes even into the axilla a little bit.
How do you do that?
You cut it out.
Is it painful? Because I look at it, we're using our arms all the time.
It's not super painful, but it can be really uncomfortable just because of what you said. You use your arms for everything.
Well, you can't walk around like this for how many weeks before you can use your arms properly?
Well, you'll be using your arms right away, but until you're using them without any thought or concern, it's probably a month.
Okay, more common in women than in men?
Definitely more common in women.
Really?
Mm-hmm.
Have you done it on men before?
I've only done a smaller version of the arm lift on men.
Okay, how bad is the scarring on having this procedure, and is it long-term scarring?
So you'll have an incision forever that runs from the elbow up to the armpit on the inside of the arm. So when the arms are down, you won't see that. When the arms are up or you're doing anything, you might see that incision. It is a tough area to get a really thin incision, and it's not uncommon to have to revise segments of that scar.
Will you be able to have the same strength in your arm? So you're not affecting the muscle, are you?
No, we're staying away from the muscle,
that.
nerves, and vessels. There's a lot of nerves and vessels that run on the inside of the arm. We're trying to leave that deep layer of fat right over those to protect them.
Okay, is there a risk for this?
Really, they're minor risks, common things. You know, the scar is unsightly, or it's red, or it's wider than we want. Those are the common things. Can you have nerve damage or damage to the blood vessels? You could. Have I ever had it? Thank heavens, no. All
right. Dr. Dunkley, thank you so much. If you want to find out more information about Dr. Dunkley and Envision Cosmetic Surgery, head over to theyoungeryou.tv. It's a really interesting episode tonight. I hope you enjoy it. Back to you in the studio.
And as you can see, you can catch that tonight on CW30 at 9:30 p.m. and then every Saturday on ABC4 Utah at 4:30
That's right.
p.m. How about
I'm
that?
excited to tell you I'm having it done.
You are?
Yeah.
No, you're not. Are you really?
No.
I don't think you need it, Joe.
No.
Are you okay?
I'm okay.
All right. But of course, presenting those different options that are available to you when you're striving to, you know, feel and look your best.
Hey, you know, it's all about you got to feel comfortable with you. And if you don't, then you take steps. And if those are the steps you take, then that's what you do. So there you go.